Biological, cultural, spiritual, and psychosocial needs, Part 1. Maslow's hierarchy of needs is based on the concept that we all have basic needs that are necessary for human survival and health. The extent to which these needs are met is a factor in determining a person's level of health. Physiological needs must be met first. And remember, pain is not a physiological need. These include life-threatening illnesses, respiratory difficulties, circulatory concerns, nutrition, hydration, elimination, temperature regulation. Safety and security needs are met next, and these include environmental hazards, fear, and anxiety, along with psychological safety. When applying the model to healthcare, make certain that you look at the individual's needs rather than thinking that you have to follow the model. Again, look at the whole picture and determine the most pressing needs for the situation and the client. How individuals view themselves will affect the way in which they care for themselves physically, emotionally, and how they care for others. Mastery of each developmental stage in one's life leads to strong self-esteem. Self-esteem generally will begin to decline in later adulthood. Identity is defined as being oneself. It's distinct and separate from others. Body image is one's attitude regarding the body, physical appearance, structure, and/or function. Body image changes or misconceptions can have an impact on psychological well-being. Nursing staff can have a major impact on a client with an altered body image by being sensitive verbally and non-verbally with responses to client. Make sure that you always convey genuine interest and acceptance, not shock or disgust. Role performance is how a person will perceive his or her ability to carry out significant life roles. Self-esteem is a person's overall feeling of self-worth or the emotional side of self-concept. A self-concept stressor will challenge a person's adaptive abilities. Nurses must be able to use therapeutic communication skills and be knowledgeable about sexual function, issues, and assessment in order to put a client at ease. Sexual development, orientation, contraception, abortion, and sexually transmitted diseases are necessary for nurses to have a basic knowledge of. Sexual orientation, gender roles, sexual function can have major impacts on a client's self-concept and their self-esteem. The first 3 years are the most crucial in general gender identity development. School-age children will need accurate education on normal changes in their bodies. Puberty and adolescence will go through dramatic physical and emotional changes, and they require accurate information also about sexuality issues. Middle adulthood, they begin having physical appearance and physical changes that lead to concerns regarding sexuality. Older adulthood sexuality is often overlooked by healthcare providers, but it is an important part of physical health. Sexual orientation. Nurses have to be non-judgmental, and they have to provide care that is appropriate to the client's sexual orientation. Contraception is something that nurses should have a basic knowledge of. They need to know about the variety of methods that are available, the benefits and drawbacks of those methods, and be able to provide accurate client education. Again, nurses should remain non-judgmental regarding contraception. Sexually transmitted infections. All sexual partners of a client infected with an STI should receive treatment. Some STIs, we have to realize, are incurable, and that patient will continue to have flare-ups throughout the client's life. Embarrassment may prevent people from seeking treatment. All sexually active people are at risk for STIs, especially if there are multiple partners. Sexuality issues. Nurses should have a basic understanding of the effect of culture on sexuality. Sexuality is treated very modestly in some cultures, while in other cultures is a very normal part of life. Abortion is one of the most hotly debated subjects. Do not allow your personal views to influence your care of a client who has had an abortion. Infertility is the inability to conceive after 1 year of unprotected intercourse, and it can have significant impacts on psychological well-being. Sexual abuse. Nurses are in an ideal position to assess the occurrences of abuse, and nurses are considered to be mandated reporters. Student nurses are considered to be mandated reporters. So in other words, you will get into legal trouble if you fail to report suspected abuse. We have to look at a current history or current abuse or a history of abuse, because those can have a significant impact on psychological well-being. Sexual dysfunctioning is an absence of complete sexual functioning. It can include erectile dysfunction and hypoactive sexual desire disorder. A client's health depends on a balance of physical, psychological, sociological, and cultural development and spiritual variables. Spiritual health, spiritual care, is often an overlooked aspect of nursing care. A link does exist between the mind, body, and spirit. Healing often takes place because of a person's beliefs. A person's inner beliefs and convictions are powerful resources for healing. Spiritual beliefs usually increase with age. Spirituality will offer a connectedness. It can be interpersonally with oneself, interpersonally with others and the environment, or transpersonally with the unseen, God, or a higher power. Spiritual distress often causes a person to doubt or lose faith or question their spiritual values, raising questions about their way of life or their purpose for living or their source of meaning. Problems that can lead to spiritual distress might be an acute illness that poses an immediate or long-term threat to life, health, and or well-being. Chronic illness, which threatens a person's independence, causing fear and anxiety. Terminal illness, which is commonly a cause of fear of physical pain, isolation, the unknown, and dying. A near-death experience, where the client is often reluctant to discuss this experience. But following a near-death experience, they're usually no longer afraid of death. The Code of Ethics requires nurses to practice with compassion by accepting the dignity and worth of each client. We have to look at the spiritual side of every client. And nurses who are comfortable with their own spirituality are more comfortable when caring for clients' spiritual needs. Nurses should be familiar with health differences between ethnic and racial minorities. Often there's going to be some differences due to poorer access to health care and lower quality of preventative, primary, and secondary care. Different ethnicities and cultures are more susceptible to certain illnesses or diseases. Some cultures will have different healing modalities within their culture, or they may subscribe to healers. And healers can be naturalistic, holistic, or supernatural. Various cultures deal with significant life events in many different ways. It's necessary for nurses to be aware of the cultural perspectives of the clients that they care for. So when you do a cultural assessment, you start off by asking questions. And usually open-ended questions will encourage the client to describe their values, beliefs, and practices regarding health and illness. I recommend you look at box 9.3 in your book. Establishing relationships is really vital. We have to work at that nurse-client relationship despite potential language and communication difficulties. And again, I encourage you to look at box 9.4. You should seek to assist, support, facilitate, or enable people of different cultures while preserving, maintaining, and accommodating or negotiating those cultures. Components of a cultural assessment, you will need to look at the family structure. You integrate clients' and families' concepts of meaningful and supportive care within that assessment. Gender, age, social hierarchy, all of this can play an important part in a culture supportive care. Ethnic heritage and ethnohistory. You need a knowledge of a client's country of origin because those can be significant to health care. Bicultural history identifies a client's health risks related to their cultural history. Social organization. A client's status within the social organization of a culture is significant to health care. Religious and spiritual beliefs may influence a client's worldview of health and illness, pain and suffering, and life and death. And many cultures have significant foods within their cultures. They have particular meanings, and it's important to be aware of those. Communication patterns can reflect core cultural values of a society. And we need to realize that time has different meanings in different cultures, and many cultures may not follow a timeline that the nurse is familiar with. This is Lineger's culture care theory and sunrise model. Most importantly, we have to realize that cultures can affect the way we deal with a client. We don't want to alienate a client by being ignorant of their culture. If you have questions, ask someone or Google it.